When positioned like this for hours per day, for months or for years, it's common for parents who are breast or chest feeding to experience upper back pain. So in this video, I'm going to be going over 3 exercises that you can do to help start addressing that upper back pain. So the first exercise that we're going to do is using a foam roller, and if you don't have one, that's okay. You can use a rolled up bath towel that's rolled up so tight that it's firm, and use that to stretch your upper back. And so place your foam roller or rolled up towel on a hard surface like the floor. Now I want you to lay across your foam roller so it's placed horizontally across the middle of your shoulder blades. And now, without getting your lower back involved, I want you to allow your body to stretch back against that foam roller. And now use your hands to support your head, that way your head doesn't fall back. I like to think about keeping a fist width between my chin and my chest. Now while you're back there, inhale for 3 seconds, and then exhale for 3 seconds. Now come back up and repeat if you need to in different spots of your upper back. And as you become more comfortable with this stretch, one way that you can progress to more of an advanced technique is start to lift your hips off the floor. You can maintain that posture where you're stretching back on the foam roller and now roll up and down along your upper back. However, I don't want you to go past beyond the bottom of your shoulder blades, as that starts to roll into your lower back, which may be quite uncomfortable. Now the second exercise is to strengthen your upper back muscles. So when we're sitting like this for breast or chest feeding, what's happening is that your upper back muscles are becoming stretched for a long period of time. Muscles, I like to think of, are similar properties to rubber bands, where if you stretch a rubber band for a long period of time, then they start to lose that strength or elasticity to come back. And that is essentially what could be happening for your upper back muscles, is that they're being stretched for so long, they're losing their strength to support a good posture, and now you're relying on ligaments and the tendons of muscles to help hold everything so you're not just falling forward. What I want you to do is imagine yourself sitting, standing, or lying down with extremely good posture, right? I'm gonna imagine my head is as tall as I can, and that already feels really good. Okay, now we're sitting in a good posture. Imagine someone is poking you right in the middle of your shoulder blades. Now I want you to take your shoulder blades and try to pinch their fingers for 5 seconds, and then relax. Now when you're pinching your shoulder blades back, the direction you pinch is important. So I want you to think we're pinching back and down instead of back and up. And the difference is that when you start to pinch and you feel your shoulders rise up towards your ears, is that you're recruiting these large upper trapezius muscles that are really associated with stress, right? You see a lot of people who are stressed have this up posture, and that's something you want to avoid. Instead, we're looking to strengthen the muscles that lay on the bottom of your shoulder blade to help maintain this back and down posture to help support your back for good posture. And the third and last exercise is another stretch. However, this is a stretch for your chest. Now when chest or breastfeeding, right, we have this forward rounded posture. You can imagine your chest muscles, they're just being scrunched for a long period of time. And when they're scrunched forward like this, they start to lose their flexibility or their elasticity to come back. And if they're short and pulling everything forward, then again, that is contributing to this forward rounded posture, which commonly is the cause of upper back pain. And so standing in front of an open doorway, I want you to take your hands and place them on the edge of the frame of the door. We're gonna put 1 foot forward and 1 foot back to get a nice, strong stance. And then you're just gonna lean your chest forward, trying to keep your chin out of it, making sure your neck stays in line. Think about that fist between the chin and chest again. And again, not allowing those shoulders to rise up towards your ears and instead stay down. Now, this stretch, I want you to hold that for maybe 30 seconds, a minute if you can, without, other family members starting to cry or whatnot. And once you're finished, then switch legs and do the other side. My name is Dr. Tim Roser, and this is Tummy Time Academy. Thank you for sticking around and watching my video. Make sure to hit that like and subscribe button to stay tuned to my next video.